Most people grow up believing that if a surgeon recommends an operation, it must automatically be the right decision. After all, doctors spend years in training, hospitals have advanced equipment, and medical systems are designed to help patients get better. When a physician says surgery is necessary, many people feel there is little reason to question the recommendation. They sign the forms, trust the process, and hope for the best. Yet for many older adults, the reality can be far more complicated than they ever imagined. Over the years, countless patients have entered hospitals expecting relief from pain or a cure for a medical problem, only to face outcomes they never anticipated. Some recover beautifully, but others experience complications that permanently alter their lives. A person who walks into surgery independently may leave requiring assistance with daily activities. Another may survive a technically successful operation, yet spend months struggling with weakness, confusion, or a loss of confidence that never completely disappears. These are difficult truths, but they are important truths that every older adult deserves to understand. The challenge lies in the fact that aging changes the way the human body responds to stress. Surgery is not simply about fixing a damaged organ or replacing a worn-out joint. It is a major event that demands tremendous energy and resilience from every system in the body. The heart must work harder, the lungs must recover from anesthesia, the kidneys must process medications efficiently, and the immune system must coordinate healing. As we grow older, these systems often operate with less reserve capacity than they did in earlier decades. One of the most overlooked issues is the effect of anesthesia on the aging brain. Many seniors are surprised to learn that confusion and memory problems after surgery are not uncommon. Doctors refer to this as post-operative cognitive dysfunction. Some patients experience mild symptoms that resolve within days, while others struggle with concentration, memory, or mental clarity for weeks or even months. For families, these changes can be frightening because they were never fully prepared for the possibility. Understanding these risks ahead of time allows patients to ask better questions and make more informed decisions. However, age alone should never be viewed as a reason to avoid surgery. There are individuals in their 80s who recover remarkably well from major procedures because they remain physically active, maintain good nutrition, and have few underlying health problems. At the same time, some people in their 60s may face greater risks because of multiple chronic conditions or reduced physical strength. This is where the concept of frailty becomes important. Frailty is a medical condition that reflects the body's diminished ability to handle stress. It is not simply about chronological age, but about physical reserves. A frail individual may have difficulty recovering from illnesses, injuries, or surgeries that a healthier person could tolerate more easily. Recognizing frailty helps doctors and patients understand that surviving an operation and thriving afterward are two entirely different goals. Ultimately, the most important question is not whether someone can make it through surgery itself. The real question is whether they can recover in a way that preserves their independence, dignity, and quality of life. Being an informed patient means asking questions, seeking second opinions when necessary, and understanding all available options. Surgery can save lives and improve well-being, but the best decisions are made when patients fully understand both the potential benefits and the hidden risks that come with every procedure. One of the most important lessons for older adults is understanding that not every major surgery carries the same level of risk, and not every traditional operation is still the only option available. Modern medicine has made incredible advances, yet many patients are never fully informed about alternatives that may be safer and less demanding on an aging body. This is especially true when it comes to open heart surgery and aggressive spinal procedures, two operations that deserve careful consideration in people over 60. Open heart surgery has long been considered one of medicine's greatest achievements. Procedures like coronary artery bypass grafting have saved millions of lives by restoring blood flow to blocked arteries. For many patients, these surgeries are absolutely necessary and highly effective. However, the physical demands of open heart surgery are enormous, particularly for older adults who are already dealing with conditions such as diabetes, kidney disease, or mild cognitive decline. During traditional bypass surgery, the heart is temporarily stopped while a machine takes over the work of both the heart and lungs. Although this technology is remarkable, it places significant stress on every organ in the body. Younger individuals with strong physical reserves often recover well, but frail elderly patients face a much greater challenge. The kidneys may struggle to process medications. The lungs can take longer to regain full function, and the brain may experience confusion or memory problems that last far beyond the hospital stay. Research has shown that complications such as stroke, kidney failure, prolonged ventilation, and extended periods of cognitive impairment occur more frequently in older, frail individuals. In some high-risk patients, the first month after surgery becomes the most critical period, with recovery proving far more difficult than anticipated. This does not mean that open-heart surgery should automatically be avoided, but it does mean that patients deserve honest conversations about their personal risks and potential alternatives. Fortunately, medical innovation has introduced less invasive procedures for many heart conditions. Transcatheter techniques allow physicians to repair or replace certain heart valves without opening the chest or stopping the heart entirely. These procedures often involve smaller incisions, shorter hospital stays, and faster recoveries. For elderly patients whose bodies need gentler treatment, such options can make an enormous difference in both survival and quality of life after the procedure. Snorts. Another area requiring careful thought is spinal surgery. Chronic back pain affects millions of seniors and can significantly reduce mobility and independence. Understandably, many people seek permanent solutions when pain interferes with daily living. As a result, spinal fusions and complex decompression surgeries have become increasingly common recommendations for older adults. There are situations where spinal surgery is unquestionably necessary. Severe nerve compression causing paralysis, loss of bladder control, or progressive neurological damage requires immediate intervention. In these cases, surgery can preserve function and prevent permanent disability. However, elective spinal fusion for long-standing degenerative back pain presents a much more complicated picture. Studies have indicated that many elderly patients experience complication rates exceeding 40% following complex spinal procedures. These complications include infections, blood clots, hardware failures, and a condition known as adjacent segment disease, where the vertebrae above and below the fused area begin to deteriorate because of altered spinal mechanics. In essence, stabilizing one part of the spine may place additional stress on neighboring sections. Perhaps most surprising is the evidence suggesting that for many older adults, physical therapy, targeted injections, and conservative treatment approaches provide pain relief comparable to surgery over the long term. The difference is that these options avoid many of the serious risks associated with major operations. Sometimes the wisest medical decision is not to proceed immediately with surgery, but to explore every available alternative first. The key message is simple: ask questions. Seek second opinions, and never assume that one recommendation represents the only possible path forward. Modern medicine offers more choices than ever before, and informed patients are better equipped to select the option that truly aligns with their health goals and quality of life. Cancer is one of the most frightening words a person can ever hear. The moment a diagnosis is made, the natural instinct is immediate and powerful. Remove it, destroy it. Do whatever is necessary to eliminate it as quickly as possible. That reaction is completely understandable. Most people believe that surgery represents the strongest and most decisive weapon against cancer. In many cases, it truly is. But for older adults, especially those who are frail or managing multiple health conditions, the decision to undergo major cancer surgery deserves a much deeper conversation. The purpose of cancer treatment is not simply to remove a tumor. The ultimate goal is to give patients more years of life that are meaningful, active, and fulfilling. Sometimes a technically successful operation accomplishes exactly that. Other times, the physical demands of the procedure may take away the very quality of life that patients hope to preserve. Understanding this balance is one of the most important aspects of modern medical care. Take pancreatic cancer surgery as an example. The Whipple procedure is among the most complex operations performed in medicine today. Surgeons remove the head of the pancreas, parts of the small intestine, the gallbladder, and portions of the bile duct, followed by extensive reconstruction of the digestive system. The operation itself may last anywhere from 6 to 10 hours. In younger, healthier individuals, this procedure can provide years of additional life and in some cases, a chance for long-term survival. However, the situation changes dramatically when an elderly patient already struggles with heart disease, reduced kidney function, diabetes, or general frailty. The surgery may technically succeed, and the cancer may be removed. Yet the body may simply lack the strength to recover from such an enormous physical challenge. Some patients do not succumb to the cancer itself, but to complications that arise during the recovery process. Infections, organ failure, or prolonged weakness can become overwhelming obstacles that the body cannot overcome. This reality introduces a concept that surgeons sometimes refer to as failure to rescue. The operation goes according to plan, but when complications occur, a weakened body is unable to recover. For older adults, this risk deserves serious attention because survival is not measured solely by leaving the operating room. It is measured by returning home, regaining independence, and enjoying meaningful time with loved ones. Fortunately, surgery is no longer the only treatment option available for many forms of cancer. Advances in radiation therapy, targeted medications, immunotherapy, and careful monitoring strategies have expanded the possibilities for older patients. In some cases, these alternatives may provide comparable outcomes with significantly fewer risks. The best approach depends not only on the type of cancer, but also on the individual's overall health, personal goals, and expectations for quality of life. This is why one question can completely change the conversation. What would treatment look like if surgery were not the first option? Asking about watchful waiting, radiation, targeted therapies, or less invasive interventions opens doors that many patients never realize exist. Sometimes those alternatives offer a better balance between extending life and preserving independence. Joint replacement surgery presents another important consideration for older adults. Hip and knee replacements have transformed millions of lives, restoring mobility and reducing chronic pain. For the right candidate, these procedures can mean returning to activities that once seemed impossible. Grandparents can play with their grandchildren again, travel comfortably, and maintain a greater sense of independence. Yet, elective surgery means there is time to prepare, evaluate risks, and determine whether the timing is truly right. Older patients with multiple serious health conditions, including heart disease, chronic kidney disease, obesity, or diabetes, face increased risks of blood clots, pneumonia, and hospital-acquired infections. The body must be ready not only for the operation itself, but also for the demanding rehabilitation that follows. Preparation makes an enormous difference. Optimizing blood pressure, controlling blood sugar levels, improving cardiovascular fitness, and participating in prehabilitation programs can significantly reduce complications. Building physical strength before surgery often determines how quickly a person regains mobility afterward. The lesson is simple but powerful. Major cancer surgeries and elective joint replacements should never be viewed as automatic decisions. Every patient deserves a thoughtful discussion about risks, benefits, alternatives, and personal goals. The best medical choice is the one that supports not only longer life, but also a better life, preserving the independence and dignity that matter most in the years ahead. Emergency abdominal surgery is very different from the other procedures discussed because in most cases, patients do not have the luxury of time. There is no opportunity for weeks of preparation, multiple consultations, or carefully weighing different treatment options. Emergencies happen suddenly and demand immediate action. A perforated bowel, severe internal bleeding, or a ruptured appendix can quickly become life-threatening situations where every minute matters. Yet, for older adults, these emergencies carry some of the highest risks in all of medicine. The reason is not a lack of surgical skill or modern technology. It is the reality that an aging body responds differently to sudden trauma. When a younger person experiences a medical emergency, the heart, lungs, kidneys, liver, and immune system often have enough reserve to handle the stress. In seniors, especially those with existing health conditions, those reserves may already be limited. The body is forced to fight on multiple fronts at once, and that battle can be overwhelming. Studies have shown that emergency abdominal surgeries in patients over the age of 75 carry mortality rates that can range from 30 to 50% in severe cases. Those numbers sound frightening, but they highlight an important truth. The greatest protection is prevention and early intervention. Many abdominal emergencies begin with symptoms that develop gradually. Persistent pain, bloating, constipation, changes in bowel habits, or unexplained discomfort should never be ignored simply because someone assumes they are a normal part of aging. Seeking medical attention early can make an enormous difference. Problems identified in their early stages often require less invasive treatment and carry significantly better outcomes than those discovered after they have progressed into full emergencies. In many situations, what could have become a major operation can instead be managed through simpler interventions, shorter hospital stays, and faster recovery periods. Another crucial aspect of emergency surgery is family communication. Difficult conversations about medical preferences are often postponed because they feel uncomfortable or unnecessary. However, waiting until a crisis occurs places tremendous emotional pressure on loved ones. Families suddenly find themselves making life-altering decisions in hospital corridors without knowing what the patient truly wanted. Discussing these issues ahead of time is not an act of pessimism. It is an act of compassion and preparation. Older adults should talk openly with their families about their wishes regarding emergency procedures, quality of life, and the outcomes that matter most to them. Understanding a person's values helps loved ones make decisions that honor those priorities when time is limited and emotions are running high. Beyond emergencies themselves, every senior considering any major operation should have a framework for making informed decisions. 4 essential questions can serve as powerful tools during conversations with surgeons. The first question is simple but important. What happens if I choose not to have this surgery right now? In many cases, the answer reveals that there is time to think, seek additional opinions, or improve overall health before moving forward. The second question focuses on alternatives. Medicine has evolved dramatically over the past 2 decades. Minimally invasive procedures, robotic techniques, catheter-based interventions, and advanced therapies have created options that did not exist for previous generations. Asking whether a less invasive approach is available can sometimes completely change the treatment plan. The third question addresses recovery. Patients should ask what recovery realistically looks like for someone with their specific health profile rather than relying on average outcomes. Age, medications, heart function, kidney health, and living circumstances all influence how the healing process unfolds. Personalized answers are far more valuable than general expectations. The fourth, and perhaps most overlooked question, concerns the surgeon's own experience. Asking about personal complication rates in older patients provides valuable insight and demonstrates a commitment to informed decision-making. Skilled, confident surgeons understand the importance of transparency and should welcome thoughtful questions from their patients. Knowledge should never create fear. Instead, it should provide confidence and clarity by recognizing risks, understanding alternatives, preparing thoroughly, and communicating openly with loved ones. Older adults place themselves in the strongest possible position to make decisions that support both their health and their quality of life. Preparing for surgery is one of the most powerful things an older adult can do, yet it is often the part that receives the least attention. Surgeons spend years mastering complex procedures, but patients rarely spend even a few weeks preparing the body that must endure the operation and the recovery that follows. The truth is that what happens before surgery can influence the outcome just as much as what happens inside the operating room. A stronger, healthier, and better prepared body simply heals more effectively. This preparation process is known as prehabilitation. Think of it as training for a major event because that is exactly what surgery is. Even while a patient is asleep under anesthesia, the body is working incredibly hard. The heart, lungs, muscles, immune system, and brain are all being challenged. Building physical reserves beforehand gives the body a much better chance of handling that stress successfully. Nutrition is one of the first areas that deserves attention. Many adults over 60 unknowingly consume less protein than their bodies require. Protein is essential for repairing tissues, supporting the immune system, and rebuilding strength after surgery. Increasing healthy protein intake in the weeks leading up to an operation can significantly improve healing and reduce complications. Simple changes such as adding lean meats, fish, eggs, dairy products, beans, or other protein-rich foods can make a meaningful difference. Physical activity is equally important. Daily walking, even if it is only around the neighborhood or inside the home, helps strengthen the legs, improve circulation, and increase lung capacity. Stronger muscles make it easier to get out of bed and move after surgery, which in turn reduces the risk of blood clots, pneumonia, and other post-operative complications. Movement is one of the body's greatest tools for recovery, and the better condition a person is in beforehand, the more quickly they can regain their independence afterward. For smokers, even a short period of quitting can provide measurable benefits. Stopping smoking just 2 weeks before surgery lowers the likelihood of wound infections, breathing problems, and delayed healing. While longer periods are ideal, every smoke-free day contributes to better surgical outcomes. It is a simple step that can have a profound impact on recovery. Another important conversation that many patients overlook is the one with their anesthesiologist. Older adults should bring a complete list of every medication, vitamin, herbal supplement, and over-the-counter product they use. Certain substances interact with anesthesia in unexpected ways, increasing the risk of complications or prolonged confusion after surgery. Open communication ensures that the medical team can plan the safest possible approach. Patients should also ask whether regional or spinal anesthesia is an option instead of general anesthesia. For many procedures, particularly hip and knee operations, numbing a specific area rather than putting the entire brain under anesthesia can reduce the chances of post-operative cognitive dysfunction. Preserving mental clarity is especially important for older adults, and these discussions should happen well before the day of surgery. Recovery planning at home is another critical piece of preparation. Families should arrange transportation, temporary assistance, and a safe living environment before the operation takes place. Removing loose rugs, organizing medications, and minimizing the need to climb stairs can prevent accidents during the vulnerable first days after returning home. Those initial 72 hours often establish the pace for the entire healing process. Seeking a second opinion is equally valuable. Some patients hesitate because they fear offending their surgeon, but experienced physicians understand and respect the importance of additional perspectives. Different specialists may offer different recommendations, and those differences provide information that helps patients make better choices. A second opinion is not a sign of distrust. It is a sign of thoughtful and responsible healthcare decision-making. Ultimately, surgery should never be approached with fear, but it should always be approached with preparation. Patients who enter the process informed, physically stronger, and supported by family and healthcare professionals place themselves in the best possible position for success. Modern medicine offers incredible opportunities, but the most powerful tool remains an active, knowledgeable patient who understands that every surgical recommendation is the beginning of a conversation, not the end of one.